Remember the black and white slice from CT or MRI scan, and now transform it into these massive manipulatable 3D models. Okay, and this not just improve our understanding on the complex structure, but it's also help us to be better in to be critical in our clinical decision, and also to reduce the potential for diagnostic error. Okay, so we can see that this is basically something that's happening right now in healthcare, and of course, okay, it will be a game changer for medical students, for professionals, which is something that we will go through later. Okay, so now, okay, if you look into the traditional versus DXR enhanced imaging, okay, so we must first acknowledge that the inherent challenge of traditional imaging. Okay, what is happening before, because for decades, okay, the highly trained clinician have to look at 2D slides from CT or MRI scan, and then they have had to mentally, they have to really use their own skill to mentally reconstruct a 3D view. And this is basically took years of skill for them to look and to read the report. And this is an incredibly demanding cognitive task, and we cannot deny that, you know, it relies heavily on their experience, spatial reasoning, and of course a bit of guesswork. Okay, so this is what's happened here for decades. This is how they read and understand the data. So there is a limitation for this process. For example, the limited depth perception of orientation, and it is also difficult to basically truly appreciate the complex relationship between a tumor, for example, and the nearby blood vessel. Okay, and this can also increase the potential of human error, especially in the complex cases. Yeah, so I think some of us maybe, you know, haven't any experience yet. Try to explain the CT scan to a patient or to your junior students, yeah, and it can be incredibly difficult. So these flat image are abstract, okay, and it is very hard to understand. And correlating this image data with actual pathology sometimes can be time consuming. So this is a very mentally taxing process for clinicians. So now we are asking our best mind to solve a 3D problems with 2D tools. So it is the time for us for an upgrade. Okay, all right. So the next one, okay, will be discussed by my fellow colleagues. Okay, on how the XR enhanced imaging provide the advantages, okay, especially to the professional in the field and also the clinical application. Thank you very much.
So, shall we continue? Okay, this is where XR enhanced imaging, okay, comes back. This is called extended reality, okay, or another name for it. This is example ER, but another name for it is XR. Okay, so it's changing the whole identity of traumatic brain injuries nowadays. No more like really doing the surgery and so on. Okay, and for children especially, okay, it's crucial. This is very crucial because, you know, the space for the whole injury to happen is like very small, and if it happen, the person who actually do the intersection has to be very careful and precise, right? So we have to identify, it's very crucial for especially children to know the information and how it is built. Okay, you have your IEP program, right? IEPs. So to bridge the gap between the clinical diagnosis and the practice to support the day-to-day classes. Even for classrooms education, we actually use this so that students who's going to be person who actually specialize in this know how to do it. Okay, so what is TBI? Anyone knows what is TBI? Traumatic brain injury. Okay, so quick definition. Okay, TBI, injury brain to to the brain that caused by external mechanical forces. External mechanical forces. Okay, so in children it's very common. Okay, and it resolves normally when sports education, okay, or other physical activity that happen in classroom, even in a small classroom. Okay, this can happen anytime. Okay, so when the student are having some classroom activity, okay, the student are having classroom activity, and especially like primary school children, they will run around, okay, and things like that. Injuries can just happen. It's just accident. Okay, so for this, the results could be very bad if you don't get a proper treatment, or if the parents just leave it, nothing happened, okay, no swelling, nothing. The parents just leave it. It's going to be very bad. Okay, not that at that point, but later on. Okay, so the impact can cause until the skull. Okay, within the skull, if it's until the skull is still okay, a bit damage, but if it goes to the nerve, which you do not know, okay, this will cause a lot of damage to the child. Okay, sometimes if until the nerve, the swelling won't happen. It is internal, right? So the challenges to understand the nature, external and internal injury, especially in classroom, you have to be careful. You are going to be the future teachers, all right? So that part you need to know. So how XR enhance the diagnosis, right? First of all, they always rely, okay, normally we rely on 2D scans, right? 2D scans. So 2D scans like MRI, you see it's 2D scans, right? But now you can have a fully capture, okay, with 3-dimension complex scan. Alright, so this is a very good impact to see the functions of the injury, where it happens, and which part it might, later on, which part it might affect the child. You have to tell the parents, okay, this happens, you have left this child for a very long time, okay, things can be done, but it might affect the children later. Okay, so parents can be alert. Whatever difference that happened to the child, the parents can be alert. Okay, that's 3 types. First, AR for children, okay, 3D CT scan. MRI also, we have 3D nowadays, especially for the head. And then we have VR, virtual reality. This is a further step when we place a child in a simulated virtual environment, okay, to perform specific tasks, and we allow a safe environment for the child to have that task. Whether the child can perform the motor skill properly or the child can't, you can detect from VR. Okay, and then you have a mixed reality, MR. This is a merge between both dynamic 3R and also the motor skill for the patient, right? Okay, let's this is type of injury that can happen. Okay, very common, especially in classroom. Okay, let's see. Human brain anatomy. How many of you can tell me any of this part? You can just let me know what is their function. Anyone?
Frontal lobe is where you process. It's where your like movements and everything is like if it's damaged, you won't be able to like speak properly or move your arms or legs or
Correct.
something like that.
It's mostly regarding the sensory,
Yeah,
yes,
yeah.
sensory information. It is collected frontal. Alright, so it is like the touch, temperature, pain, like your speech is sensory information. Alright, so this is in relation to the object around you. Okay, so if anything happened that part, especially the frontal lobe, anything around you, you cannot sense that fast. It will take time. Alright, anyone else can try?
The cerebellum is where you process your memories. What are the
cerebellum.
And the spinal cord will be attached. It's what attaches your brain to the rest of your body. So if anything happens there, you won't be able to move.
Cerebellum is for the coordination, for the balance, and of course to control your motor skill. So the memory power is also controlled by cerebellum. Why? Because motor skill you have to remember. Like, how do I answer the phone? I have to remember, I need to pick up, all these are from your cerebellum. Okay, but it happens very fast, which you don't realize the timing. Okay, so this is memory system. Right? Other than that, occipital, spinal cord,
Hospital maybe the spot. Spot.
the spot. Okay,
Only mechanism.
the spot mechanism.
Yeah, such as the run and the jump.
Time to go through these 5 cases studies. The study focuses on XR in medical imaging, enhancing diagnosis and training. The first case is about Holy Eyes XR system in surgery and telemedicine. So this one, it aids in the surgery planning, navigation and telemedicine, and which allows the clinicians to better understand and their patients and the relationship between them. By using the CRN or the MRI scans, this system can this system models interacted with the patient specifically and interoperatively. So it enhances surgery and it supports the remote collaboration through the immersive visualization. About the second case is the 3D visualization of medical data using this XR. This one focuses on the visualization complex medical data, such as the CT or the MRI, and through this XR to aid diagnosis and training. So this immersive experience improves the spatial understanding and the interpretation of anatomic structures. So through this visualization on the XR headset, from this case, the study revealed that increased diagnostic confidence and educational effectiveness. It emphasized enhancing resolution and UI design for its better usability in clinical settings. While for the case 3, this used the cadaveric MRI, which integrated with XR platforms to improve anatomy technology. So this module could interact with layered anatomical data, so it leading to better relation and spatial understanding. And also, participants showed improved test scores when trained using these XR tools. And the XR enhanced MRI visuals allowed rotation, zoom, and 3D layering enable active learning versus passive textbook reading. This is from the previous case. For the case study 4, this study described a cloud-based XR system, and this system using the smart glasses, which overlay the 3D reconstructions of patients, and by using the CT or MRI data for navigation during the surgery. So from this system, which we named it Hollow Eyes MD, enabled the real-time surgical assistance using holographic imaging. So these XR glasses linked to the cloud ensure the high fidelity and latency-free rendering, improving the surgical precision. The last study is the XR for the spine imaging and surgical simulation. So this case applied the XR to the spine surgery, which allow visualization of patient-specific spine modules and from that imaging data. So it supported pre-surgical simulation and intraoperative guidance. From this study, this customized XR environments helped the surgeons becomes procedures visually. So it also reduced operative times and complication. So this study calls for broader adoption across spine centers. And that's all.